In this video, let's end the confusion between cholelithiasis, cholecystitis, and cholangitis. All these sound pretty similar, right? Yeah, that's what caused the confusion too. So let's end the confusion now. First, let me tell you, all these are gallbladder and biliary causes of abdominal pain. So what happens in all these conditions? Firstly, let's learn how to divide the words into different parts. So basically, lithiasis means stones. You'll be knowing that from your medical knowledge. And itis means inflammation. So firstly, let's divide these four words into two classes, cholelithiasis and cholelithiasis on a side. And on the other side, let's keep cholecystitis and cholangitis. So first, let's learn what is cholelithiasis. As I told you, lithiasis means stones, and chole means gall or bile. So what exactly cholelithiasis means? Gallstones. Pretty simple. So let me take you back to the anatomy classes. This is the liver, and this is the left hepatic duct, and this is the right hepatic duct. Both of them join to form the common hepatic duct. And here you can see the gallbladder through the cystic duct joins the common bile duct. Formation of gallstones in the gallbladder is called as cholelithiasis. Cholelithiasis doesn't cause any symptoms until it moves or causes any obstruction on its way. So let me show you another picture here. You can see there are the presence of gallstones. This is what we call as the cholelithiasis. And until it moves out from the gallbladder, either in the cystic duct or to the common bile duct, it doesn't cause any symptoms or pain. Once it starts moving, or once it causes an obstruction at the cystic duct, or once it causes obstruction at the common bile duct, then the patient experiences pain and other symptoms too. So how do we diagnose cholelithiasis? So we will diagnose cholelithiasis with the help of an ultrasonography, and the treatment will be either conservative management or the removal of gallbladder, which is called as the cholecystectomy. Removal of gallbladder is called as cholecystectomy. So let's revise this again. Chole means gall or bile. Lithiasis means stones. So cholelithiasis means gallstones. Liver through the left hepatic duct and the right hepatic duct forms the common hepatic duct. Cystic duct joins the common hepatic duct to form the common bile duct. So until and unless the gallstones starts moving either through the cystic duct or start obstructing the cystic duct or starts moving through the common bile duct or either obstructing the common bile duct, in all these conditions, the patient starts experiencing pain and other symptoms like nausea, vomiting, etc. So cholelithiasis, as it is, doesn't cause any symptoms. Hope you understood what is cholelithiasis. And now let's see what is cholecystitis. I told you earlier, itis means inflammation, and cyst means bladder, and chole means gall or bile. So chole plus cyst makes the gallbladder, and itis makes the inflammation of the gallbladder. So cholecystitis means inflammation of the gallbladder. So let's see the anatomy again. How does the inflammation happen? So once the gallstones move through the cystic duct, and once it obstructs the cystic duct, then the contents of the gallbladder become stagnant. And at this point, the gallbladder starts getting inflamed. Not only inflammation, if the obstruction is so long so as to create the sufficient breeding ground for the bacteria, it can cause infection too. So in both inflammation and infection, the patient experiences symptoms like right upper abdominal pain, which is also called as a biliary colic. Actually, it is the pain when the gallstone obstructs or moves through the cystic duct. And at this point, the patient starts experiencing pain. But this pain disappears if the gallstones travels back to the gallbladder. So this is why the pain is kind of intermittent. It comes and it goes. So if the characteristic of the pain is intermittent, then you can think of a possibility of the gallstone going back from the cystic duct to the gallbladder. But once it blocks the cystic duct, the inflammation of the gallbladder starts. So infection might occur because of the stagnant contents in the gallbladder where bacteria will proliferate. So once again, let's revise it. Cholecystitis means inflammation of the gallbladder, and what are the symptoms a patient might experience when he gets the obstruction of the cystic duct. There will be fever, there will be right upper quadrant abdominal pain, nausea, and vomiting. The diagnosis is again by USC, and the treatment will be with the help of antibiotics if there is an infective spectrum. And the removal of the gallbladder is indicated in some cases, which is called as the cholecystectomy, as we told in cholelithiasis too. Hope you got what is cholecystitis. Now let's move to what is called as the cholelithiasis. Lithiasis means stone, and choledoku means common bile duct. So the presence of a gallstone in the common bile duct is called as the choledocholithiasis. So let me show you the anatomy again. Liver, left hepatic duct, right hepatic duct join together to form the common hepatic duct. Gallbladder through the cystic duct joins the common hepatic duct to form the common bile duct. If the gallstone moved through the cystic duct into the common bile duct and somewhere it obstructed the common bile duct, now this is called as choledocholithiasis. Gallstone in the common bile duct is called as choledocholithiasis. So what happens here? The Contents of the gallbladder gets obstructed. The outflow from the liver got obstructed. So of course, the patient will experience jaundice, nausea, and vomiting. Remember, in the conditions which we studied earlier, there was no jaundice. And in this case, there is jaundice because the content of the liver, the outflow tract from the liver is also blocked. So that's why the patient gets jaundice here. And when there is CBD obstruction, there is obstruction to the gallbladder and there is obstruction to the common hepatic ducts. That's what I told you. Diagnosis is done by USG, and more accurately, you can diagnose it by either ERCP or MRCP. And how would we treat cholelithiasis? Treatment is the removal of the CBD stone. Of course, we should remove the obstruction, and removal of the gallbladder, which is called as a cholecystectomy, and antibiotics in patients with infective conditions. Hope you understood what is cholelithiasis. Now let's see what is the final condition called as cholangitis. Chole means bile or gall, we know that, and angio means vessel or a duct. Itis means inflammation. So cholangio means bile duct. So inflammation of the bile ducts or the gallbladder or the liver. Let me make you understand that part in the further parts of the video. Basically, inflammation of the bile duct is called as cholangitis. But whenever there is cholangitis, there will be associated inflammation of the gallbladder and liver too when there is sufficient obstruction of the common bile duct. Let me make it clear. In this picture, you can see a gallstone which is obstructing the common bile duct. So what happens here is that the hepatic outflow is obstructed, the contents of the gallbladder is obstructed, the patient experiences fever, abdominal pain, jaundice, altered mental status. Why? Because there is hepatic encephalopathy due to the hepatic outflow obstruction, and nausea and vomiting. How would we diagnose this condition? Same like what we did in cholelithiasis. Here also we'll diagnose it by USG or either MRCP or ERCP. What is the treatment? We should be removing the CBD stones which is obstructing the common bile duct, and we would be removing the gallbladder too, which is called as a cholecystectomy, and administration of antibiotics in patients with infective spectrum. So let me summarize the whole story again. We started by dividing the words into two. In the first group, we kept cholelithiasis and cholelithiasis. Both of them are the presence of stones. And in the second part, we kept cholecystitis and cholangitis. Both of them are inflammation. First, let's see what is cholelithiasis. Cholelithiasis is nothing but the presence of gallstones, or simply gallstones is called as cholelithiasis. Cholelithiasis, as of it doesn't cause any symptoms unless the gallstone starts moving through either the cystic duct or through the common bile duct and starts obstructing any of them. So we can diagnose it by USG, and the treatment is conservative, or either we can do a cholecystectomy. Let's see what is cholecystitis. Cholecystitis is a sequelae of cholelithiasis. When the gallbladder stone moves through the cystic duct and obstructs the cystic duct, it causes the inflammation of the gallbladder, which is called as the cholecystitis. The treatment part is again antibiotics and removal of the gallbladder, which is called as cholecystectomy. Cholelithiasis means the presence of a gallstone in the CBD duct, and the symptoms are jaundice, nausea, and vomiting. Jaundice is due to the hepatic outflow obstruction. Diagnosis is by USG, ERCP, or MRCP. Treatment is removal of the CBD stone, removal of the gallbladder, and administration of antibiotics in patients who are suspected to have infection. And let's see the final condition, the cholangitis. Cholangitis is the inflammation of the bile ducts due to the CBD obstruction. So in this case, the patient will be having fever, abdominal pain, jaundice, altered mental status, nausea, and vomiting. Diagnosis is by USG, MRCP, or ARCP. Treatment is by removal of the CBD stones, removal of the gallbladder, which is called as a cholecystectomy, and antibiotics in patients who is having infective spectrum. Hope you all enjoyed the session. Thank you.